I would first give the floor to the President of the General Assembly. As I said, I'm very grateful to you, Mr. President, for your strong advocacy, and I'm very pleased to invite you to deliver your comments, please.
Your Excellency Cornel Feruta, Permanent Representative of Romania to the United Nations, Excellencies, Delegates, distinguished guests, ladies and gentlemen. Allow me first to commend the Permanent Representative of Romania, on whose insightful initiative the impetus to shine a light on this extraordinarily important matter originated, and whose permanent mission, in conjunction with those of Canada, India, Kuwait, Mexico, and Qatar, is co-organizing this event alongside the World Health Organization, UNICEF, and the United Nations Youth Office. The entire General Assembly is in your debt for providing such an ideal platform to delve more deeply into the complex dynamics of this important issue of the mental health of children and young people, and to the very important question of how can we do better. I have used the descriptor extraordinarily important because of the rising numbers of persons generally choosing suicide, particularly people in the young age cohort, quite literally in the formative and most productive years of life, who evidently see suicide as a way out or a solution of some sort to some problem or burden they are carrying. And alarmingly, suicide is the fourth leading cause of death among people aged 15 to 29 years, pointing to a widespread mental health crisis. Moreover, despite the recognition of good health as a fundamental human right that should be universally accessible, mental health is often neglected, owing in part to the stigma surrounding it. The costs and consequences of such neglects are dire and often terminal. Globally, 1 in 7 people aged 10 to 19 are estimated to experience a mental health disorder at some point in their lives. Half of all mental health conditions begin before the age of 14, with 75% emerging by age 25. And yet, in many cases, remain undetected and untreated. This already staggering number is rising further, adversely affecting the ability of an increasing number of children and adults to learn, to work, to socialize, and to fully enjoy normal lives. Sadly, as is so often the case, the mental health crisis is exceptionally acute for children in conflicts and humanitarian emergencies. UNICEF estimates that almost all children in Gaza, more than 1 million, require mental health assistance and psychological support. This is an increase from the estimated 500,000 children that were already in need prior to the current conflict. Moreover, an estimated 1.5 million children in Ukraine are at risk of depression, anxiety, post-traumatic stress disorder, and other mental health issues due to the ongoing conflict. Similarly, children across the Sudan and Haiti are enduring shocking levels of deprivation of food, tragedy, and trauma, suffering in silence, unable to access the daily nutrition and other care they so desperately need to survive. the long-term effect of such experiences on their psyche are unimaginable. Tackling mental health should not only be approached as a health issue. Promoting good mental health is also inextricably linked with respect for human rights and sustainable development. And we must collectively work across sectors to address the underlying determinants of health and well-being. Alarmingly, more than 80% of all people with mental health disorders live in low and middle-income countries, where a vicious cycle between mental health and poverty is prevalent. Averaging a mere 2.1% of government health expenditure, the global financing for mental health is already woefully low. But in developing countries, it is at, this is a real shock, it is at literally 8 cents US per capita, per person, 8 cents. For all practical purposes, therefore, it's non-existent. International development assistance for mental health is also scarce, with development assistance for children and adolescents being even more meager. Reflecting on the foregoing, we must do much more to meet the commitments we all agreed to in the political declaration last September at the high-level meeting on universal health coverage, adopted through GA Resolution 78/4. We must scale up our efforts to promote and improve mental health and well-being as an essential part of universal health coverage, including by closing the mental health treatment gap, which is estimated to be as high as 90% in some settings. Member states need to invest further in strengthening national health systems, multi-sectoral promotion and prevention, and community-based mental health programs and services. Moreover, they should leverage digital technologies to strengthen the capacities of the mental health and psychological support workforce, with particular reference to the education sector. We must also take deliberate action to uphold and protect the human rights of people living with mental health conditions and to eliminate the stigma and discrimination that they often endure. We must bear in mind the gender differences in mental health needs. This means being alert to women's specific challenges, like perinatal mental health, and their vulnerability to sexual and gender-based violence. And we must also ensure that children and young people are meaningfully involved when crafting mental health programs to respond to their needs. As we continue to engage on this issue, we must rely on the valuable guidance and support of the World Health Organization and of UNICEF. Further, we will continue to rely on the UN Youth Office in promoting youth engagement to advocate for these goals. I look forward to hearing from the eminent experts in the field, such as Andrew Solomon and Deborah Castell, and to a comprehensive discussion from all participants. And I hope that the following discussion will give impetus to the implementation of the General Assembly's first ever resolution on mental health and psychosocial support adopted last year. Further, I hope it will also serve as useful food for thought in the lead up to the 4th UN high-level meeting on the prevention and control of non-communicable diseases in 2025. And broadly, I hope it will help advance important conversations and efforts relating to the mental health issues and well-being of children and young people. I wish you all a very successful event. Thank you.